Hello Vastavam viewers. Today I am going to introduce a real-time hero who does adopting the villages and doing a lot of charity in the state of Telangana. Usually we see this kind of stories in movies, but Dr. Alok Agrawal is a real-time hero who does this kind of charity work in 250 villages of Telangana state. Let's talk to him and find out about Global Pragati, a charitable non-profit organization and different services of that organization. Okay. Welcome Dr. Alok Agrawal, and thank you for giving me this opportunity. Introducing Global Pragati, a non-profit which is doing a lot of services in the state of Telangana. Before going into those details, please give us your introduction, like where are you from in India, your professional and family background, a little bit, please.
Namaste Andy. Well, that is the extent of my Telugu. I actually was born in Mumbai and was raised in Hyderabad. My parents came from UP. My father was in central government service, atomic energy. So he moved to Bombay first after his engineering and then to Hyderabad. I came to USA in 1989. I'm a nephrologist at the VA hospital. My wife, Dr. Sangeeta Agrawal, is a gastroenterologist. She is also at the VA hospital. She's chief of gastroenterology there. I have two kids. My elder one, my son, is working at American Airlines in Dallas, and my daughter is the undergrad. My parents and my mother-in-law, they live with us in Dayton, Ohio. We've been here for about 20 years now.
Yeah, that's very good to know, Dr. Alok. When did you start Global Pragati non-profit, and what's the inspiration behind doing all this charity work in India?
Right. So basically, the inspiration or primary motivation is to help the poor people. And it is something to do with poverty alleviation. So I started one organization in India first by name Pragati Welfare Society about a decade back. Global Pragati was founded initially under a different name in USA in 2011. And then we changed the name to Global Pragati in 2015 because our efforts actually were more, they expanded, and so we had to change the name of the organization in 2015. So the primary motivation is helping the poor.
Okay, Dr. Alokji, basically you are from Bombay and your parents are from UP. And what's the reason behind doing this charity work in the state of Telangana?
Right. Good question. So my parents came from UP actually, and they went to Mumbai first. And I was about in third grade when I moved to Hyderabad. So I don't have any of my own rural background. So initially about 2001, I started working with a friend in Haryana, actually at the grassroots level, went to several villages there. And somewhere around 2008, I met my social studies teacher, Miss Burgula Sumana, in the village. Post-retirement, she had moved to Burgula village and started doing some work there. So I met her there. We did one project that led to a second one, a third one. Apart from that, I also believe that first we are all Indians. And I like to send this message to everyone, that we really need to work wherever it is with the poor. Poverty does not recognize any regionalism. It does not recognize religion. It does not recognize caste or anything else, So I think that those were some of the reasons for why I started working in Burgula area.
That's really great, Dr. Alok. So, what's the mission of Global Pragati? What are you trying to achieve there?
Mission of the Global Pragati is mainly poverty alleviation and sustainable poverty alleviation in communities uh, through education, through employment, through preventive health care, uh, and through community involvement. So that is the main mission of Pragati.
Hi all, Vastavam Media and Entertainment Channel is conducting classical dance contests to encourage Indian classical dancers around the world. Vastavam Dance ID is a worldwide dance contest for the classical dancers who can perform Kuchipudi and Bharatanatyam. Dancers from any part of the world can participate in this online dance competitions. I am very happy and excited to be part of this wonderful program. I encourage Indian classical dancers around the world to participate in this contest. I wish all the best to all the contestants and who are going to participate in this Vastavam Dance Idol 2020 contest. So, waiting to see your dance. All the best once again. Thank you.
Okay, that's nice. So, what are the different services you do from Pragati non-profit in the village of Burgula?
It's very complicated. So let me try to make it easy for all of you, the viewers. Our flagship program is in Burgula, basically. And when I went to Burgula Panchayat consisted of 3 villages and 7 hamlets, 7 tandas. Total population of about 8,000 around that time, 2011 census. So what happened is we started doing our work mainly in the field of education. But since 2013 at least, or in fact December 2012, I have been going to Burgula about 2 times a year or so, and I stay mostly in Burgula. So I felt that to focus only on education for poverty alleviation, although that's a good long-term investment, is not enough. I got involved in other areas of overall development and got involved with employability, skill training and employability of the youth, women empowerment, healthcare, mostly preventive healthcare, uh, infrastructure development, and community participation. So the flagship program is integrated rural development, and I'm hoping to create some models out there. We have been successful in creating some models, but I think we would like to see some model villages come up there. Some of them we are pretty close to those villages becoming model villages. So like I said, these are 3 villages and 7 tribal areas, and these are integrated rural development. I got involved in everything there, from education to infrastructure development to community involvement. One thing I did not get very deeply involved is agriculture. Other than that, I've done everything there. So I call it integrated rural development model. Now, with that kind of introduction, doing almost everything in Burgula, including the development of roads and street lights and everything, and we'll discuss that in a little bit again.
So, Dr. Alok, did you adopt village Burgula?
Oh, that word adoption is scary for me. It puts a lot of pressure on me, I feel, and I keep telling the villagers that you have to adopt me and then we really can be successful. But yes, you can say that I have sort of adopted that village. I've been working there for about a decade. Some small experimentation on our part to make a difference, to create a model of development there. So now with that kind of effort, a complete holistic approach in Burgula, what we did is some of these services we started providing to neighboring villages also. For me to spread to neighboring villages and do uh, work in as much detail as I did in Burkula was difficult. It is sometimes not possible humanly. So I actually started providing some services to neighboring villages. Now we have provided some help or other to almost 250 neighboring villages of Burgula, in
250
preventive health
villages?
care, in education, in providing them some information, something or other about 250 neighboring villages in some of the districts. Burgula used to be in Mehbubnagar district. Now it is one of the last villages
That's
in
really great.
Rangareddy district. So,
250
Mehbubnagar
villages.
district and Rangareddy district, the entire Mandal, Farooqnagar Mandal. So, we've been doing work in those 250 villages, gradually increase the work.
Okay, so
Yeah, so let me tell you a little bit more. Like I said, those 3 villages and 7 tandas in Burgula is much more intense work. That is the main work. But the 250 villages, neighboring 250 villages, we actually help them out in something or other. For example, in the field of education, let me actually tell you a little more about our work in Burgula, a little more detail. Education, field of education, 1 high school, 7 primary schools. We have done everything in these schools, motivating teachers, motivating parents, building classrooms, auditoriums, digital. Actually, 2013 January, we started a computer lab when all the kids, all the children there were very, very uncomfortable with the use of computers. The villagers were uncomfortable. So we started this digital lab in January of 2013, and this is still running actually. So that is sustained by funding, of course, but I think that has helped villagers become much more comfortable with the use of computers. So we did that. Science lab, library, benches, fans, improving the infrastructure in the school, everything in the school, motivating teachers, parents, extra classes, morning, evening, providing books, hemoglobin check, eyesight check, hearing check. So we have done pretty much everything in these 8 schools, and some of these schools are so much better now. One of the primary school, Kasi Reddy Guda Primary School, got Swachh Pathshala Award in 2017 for entire Telangana. Beautiful atmosphere there, And again, trying to improve the standards is the other thing. About 2 years back, 200 children, they left the private schools and came back to join the government school. This was in 2018. This Kasi Reddy Guda Primary School that I just told you about, Swachh Pathshala, this school is the first English medium school in the Mandal, and the results have improved. We've had state 4th ranker, 5th ranker. We've had some good ranks in the state. The overall pass percentage has increased. So when we did work in these 8 schools, I told you about Mr. Rathore, the Mandal education officer. He came to me and he said, "Sir, you have to help me in the other schools also." He being a very nice man, we stepped into the other schools. I created library in every school. We went and motivated children. I have been to majority of these 99 schools, all the high schools, and most of the primary schools also myself, and motivated them, educated them about healthcare, preventive healthcare. We provided sanitary pads to the girls, educated them about menstrual hygiene. We provided some computers in some of these schools where we thought they would keep it safe. So, a lot of benches. Yes, benches was another thing. 1,000 benches in collaboration with Rotary Club. We put up, got about 1,000 benches for all the high schools. So, so I think we extended our support to the 99 schools. Another great program we have is Mandal Education awards, academic awards. So we instituted awards in Burgula, but we also instituted awards for the entire Mandal. And what we do is the 10th class. My goal is not to just give prize to first, second, and third, but what we do is if a high school gets more than 90% pass rate in 10th class in first attempt, we recognize that high school. Every subject, if physics, if they get almost, the highest one pass rate in physics, we recognize that teacher.
In the
So,
mandal, you said, right?
entire mandal. There are 15 high schools. So this year we are not able to hold that event. Last year we gave away 424 awards. I mean, basically the awards are not to recognize just first, second, third, because my theory is that someone will be first, second, or third. But what we need to do is we need to lift the overall standards. So recognizing a lot of students, recognizing teachers, recognizing schools, So that was a big thing. And we have done it for 3 years now. This year we are not going to do it. Next year, hopefully, we'll do it again in a bigger way. So this is about education. So we have done that. We have provided sanitary napkins, almost 1 million pads we have distributed in Burgula and this 250 neighboring villages. So there we went and educated the neighboring villages, the women, about menstrual hygiene. We educated them about preventive health care, importance of education. So we call this program Inti Pragati. So we tell them, this is what we have done in Burgula. You have to send your children to school. Make sure your youth get employed. And we give them some tools for rural development. We motivate them. So this is when it comes to women empowerment. And there are more programs in women empowerment also. Number 4, healthcare. I'm a nephrologist, but I believe in preventive healthcare. I think prevention is better than cure. When they go for curative medicine, it is very expensive to go for the curative medicine, and it is not easily accessible to the village. So the best thing for them is prevention. And what I have been promoting is clean villages, clean green villages. More than 40,000 trees were planted, clean villages. And we've had good success there, closing the drainages. Then we also put up two water plants, clean drinking water plants. And my biggest sort of project that gives me most satisfaction on a day when I'm down, about 650 toilets construction. Out of that, more than 600 are individual toilets, about 615. Every house, there were about more than 1100 houses. About 2015, about 600 plus houses did not have toilets. So I don't know if you've watched the movie. I'm sure most of the viewers have watched the movie about the toilet. We experienced similar problems, resistance from villagers to different issues. So here is one program in which we got government support, 12,000 rupees per toilet construction. But I got with my team, the labor. We got raw material for wholesale prices. I spent 5,000 rupees per toilet to improve the quality, make them functional. And they also have a...
So you gave them money to construct the toilet at their home, or
Sorry, go ahead.
Please go ahead. So how did you do that? Did you just finance them, or you helped them in construction also?
We helped them in construction. We helped them in procuring the raw material at wholesale prices. We motivated them. We had contract labor that in fact came and stayed in Burgula village also. It was a huge project. It took much longer than we thought it will take. So we did everything from motivation to finish. And even increasing the awareness why they should use toilets, We created charts, being a physician, we had charts created in Telugu, where we would tell them why they should be using toilets, what are the problems, the illnesses they can have. Uh, so this is so satisfying because in the women, almost 100% utility. Dignity for women,
Yeah.
that is where using the bathing area and the toilet, almost 100% utilization by women, by more than 90% utilization by other villagers. Two groups of villagers still not using it consistently, small children, less than 3 years old, or very elderly, changing their behavior is difficult for them. So this was, in the preventive healthcare, I was telling you, coming back to the preventive healthcare, toilets, water plant, cleaning the village, underground drainages. Then we have a very good SMILES program. It is a very comprehensive preventive healthcare program uh, to educate villagers about importance of hand washing, keeping sanitation so they don't have mosquito bites, malaria, dengue, lot of other issues there, anemia prevention, cancer prevention, high blood pressure prevention, all those education about prevention. So next is excuse me one.
Sure.
After that, we have a Sneha program. Our Sneha program is our menstrual hygiene program, and the we educate them, we give them sanitary napkins. We have a Bharat Bachpan program where we educate about child malnutrition, preventing the child malnutrition. We are improving the Anganwadis. We believe that if the population eventually has to be healthy, you have to start in early childhood, which means that a healthy mother will give birth to a healthy child. So we have a Amma program for healthy mother. India has a very high maternal mortality rate and infant mortality rate. In fact, the mortality rates, number of mothers dying during pregnancy or the children dying in 30 days, this has gone down in Telangana quite a bit recently. But we have been working there and preventing malnutrition. We admitted children with severe malnutrition to Gandhi Hospital, almost 25, 30 children we admitted there. So we have this Amma program, Bharat Bachpan program. I told you about the Sneha program. And the other thing is model primary health center. So I improved the health center. I spent about 5-6 lakh rupees there. And one of that picture is there on the website also. Beautiful PHC now. And it got National Quality Assurance NQAS, they call it. I don't remember what S stands for. They were partially accredited at national level, and there are one or two more things missing, to get that complete accreditation. So what happens is central government will give them 3 lakh rupees per year for 3 years to improve on further. Right now they're giving 1.5 lakhs because it is partially accredited. So we improved that. We had monthly medical camps in past, So a lot of things in the preventive healthcare. Number 5 is infrastructure development. We have focused on infrastructure development, Mahila Mandal building development, improvement of buildings, Anganwadi improvement, classrooms, auditorium in the schools. And then one of our biggest program or project lately has been the Pragati Rural Development Center, PRDC we call it, Pragati Rural Development Center. We bought 3 acres of land and we have done some construction there, a nice guest house with 5 bedrooms. And then we have a 3,600 square feet building with 3 meeting rooms, a large hall. And this is meant to cover the neighboring 500 villages actually. We have covered almost 250 villages. Our programs are going to increase. And then we intend to cover more villages from that center, a center of rural development, center for rural transformation, a hub for rural development. And this is the place where Dr. Satish has been to Burgula about 4 or 5 times in past. And he and API members all came there, and we had the inauguration. Sorry. We had the inauguration of the center done by the API physicians in July of 2019, July 24th of 2019. This is a beautiful complex, and I've shared some pictures. Hopefully the viewers will be able to look at those pictures too.
Sure.
This is where we were doing a lot of our activities from there.
Dr. Alok, let me interrupt you for a second here. You said you adapted 250 villages along with Burgula in the state of Telangana. So are you doing this service yourself, or you have any support from other organizations?
Right, definitely, as with time, the network has increased, and a lot of people have, individuals, organizations have started coming. To backtrack a little bit, when I started work there about 2008 or so, Burgula appeared to be in middle of nowhere, about 60 kilometers from Hyderabad, from 55 from Medipatnam area of Hyderabad, and there was Bangalore highway was not there at that time. Getting to Burgula would take me about a couple of hours. I did not have support from anyone at that time except my social studies teacher. Gradually, with time, the network has increased. More and more individuals coming to help. My own team actually expanded. I have anytime about 15 to 25 people working in the village on my team actually, and I pay them salary to do that work for their own livelihood. So
you are doing a lot of work, so it needs a lot of money, right? So how do you raise the funds?
I am actually, when it comes to raising funds, I'm not good at that. I am shy of asking for funds. And I...
So for all this charity, you are spending money from your pocket and you don't have any support. Is that correct?
Kept putting in my own funds and kept doing the work. That was more important for us, because planning the project to implementing the project, in a cost-effective way, use my personal funds. About 2013, I moved to the VA hospital, and at that time, we decided that my salary will use for charity, and every 5 years we'll make a decision. I'm not going to say that I'm going to use my salary
Dr.
for
Alok,
my
we
entire
have
life.
Dr. Kattula, Treasurer API with us now. Let me ask him about the association with Global Pragati and his support to your organization. Welcome, Dr. Kattula. Thank you for joining us. So, how are you supporting Dr. Alok and his Global Pragati non-profit from the organization API?
API has done several charity events in US as well as in India over the years. API actually has about 18 charitable clinics in India, which see about 1 million patients every year for free. They've been doing it for several years. Also, currently we are working on water plants, the safe drinking water projects we are working on. As far as supporting Global Pragati and Pragati Welfare Society in India, we have sponsored several thousand sanitary napkins which were distributed in Burgla area. We went there as API team in July, like Dr. Alok Agrawal mentioned. There were several physicians who went there to open that Pragati Rural Development Center, which is really impressive to see. That's where a lot of women come and they are trained in various skill sets. Currently, they're working on, producing masks in a massive scale. They have actually stitched so far about 80,000 plus face masks, and those are being distributed, to people in Telangana area. So they have been doing that, and we witnessed that center. We participated in that inauguration of that center, and we were there to witness all the activities that were done there. And we are actually trying to model Burgula village, which is adopted basically by Dr. Alok Agrawal and his team and the Pragati Welfare Society. So we can actually replicate the same thing in other villages if there is a sponsor. If somebody wants to do something in their village, for example, if they want to do sanitary napkins, menstrual hygiene type of project in their town or village, we can support them through Global Pragati as long as they can sponsor some money. So we're trying to market that, we're trying to promote that through API. And we also have something called Adopted Village Committee, for which Dr. Alok Agrawal is the co-chair and I'm the chair. So we're trying to work with several physicians and several members of API to replicate all these projects in other villages. It doesn't have to be their own village. As long as they sponsor, they can choose any village, and Pragati Welfare Society can go there and do these events or charitable things there. So it is really impressive and very motivational, inspirational what Dr. Alok Agrawal and his family has done. And definitely API is there to support him, and because this is all great work to help alleviate poverty and to really create infrastructure. We don't have to really do in a big scale. It's a very comprehensive type of approach what Dr. Alok Agrawal has taken. But we don't have to do all of that. The sponsor, they can if they want to, but because of the time and resources and everything, they can pick and choose any of these, either face masks or sanitary napkins, or they can even choose water plants. If they can, give like $7,000. This is not through Pragati, but this is through a different safe drinking water, organization. We can actually help set up all these water plants in their towns or villages. And these are all the things that we are trying to do. We are trying to come up with, a streamlining of the process so that it'll be easier for the people who want to do these things. A lot of people want to help their village or their town or, India, but they don't know how to do it and what to do it. So we are there to guide them. We are there to really, help them on the ground to do these things. So, whatever Dr. Alok Agrawal has done is really commendable, from education to sanitation to women empowerment to all these, things that Global Pragati and Alok Agrawal has done is really commendable. So we really appreciate that. And API also is trying to do several things. So we will be, promoting this, as I mentioned before. So that's what we are trying to do.
Thank you, Dr. Satish, for joining us in the discussion and sharing your experiences with the Global Pragati and the support you are providing to Dr. Alok. Thanks for your time.
Yeah, thanks. Yeah, bye.
So, Dr. Agrawal, so what's your message to other non-profit organizations and the people who wants to do service back in India?
Right. First of all, I would like to say that we Indians have done very well overall. After coming to US, we are doing very well. Lot of us have been involved in serving the community or doing some kind of humanitarian work for India also in our own ways, so I think I congratulate all of these people who have been doing things on their own. My own interest is more in poverty alleviation, finding sustainable solutions, long-term solutions, and somehow I feel that people should not live in poverty, and that is my main interest. And I feel that India, with such a huge population and in the rural areas, if we support them, uh, not only will it result in their standard of living improving, but it will translate into faster development for the country. So my message is for everyone to probably form partnerships, join hands with some organization or other, do it on their own. I myself, although I have the own non-profit organization, I still collaborate and partner with other organizations. If some other organization does more work than me, I'm happy, because ultimately that's what I want. I want progress for the people in India, which I cannot. I cannot do everything. So I think my message is to join hands and look at poverty. I think helping these poor people.
Wow, that's really motivating and very inspiring to know about global Pragati and your vision, your services to the poor villages back in India. Thank you very much for giving me this opportunity to introduce Global Pragati to Vastavam viewers. Thank you, sir. Thanks again for your time today.
So thank you very much. The website is globalpragati.com. You can visit the website also.
Sure.
And thank you very much. Hopefully I can talk to you all again about some of these programs. Thank you.